Go.
Okay. My name is Sandra Kearse, and for my research project I'm looking at the use of IV salbutamol in the emergency departments throughout New Zealand. Part of my interest for this particular topic is that as a health professional I'm always interested in medical practices that are parallel to my current practice as a paramedic in pre-hospital emergency care. So if we take the salbutamol as the example for my research project, we currently use salbutamol in a nebulized form for mild to moderate asthma, and adrenaline is our other use for severe asthma. So looking at IV salbutamol, seeing how that might be beneficial, perhaps taking the place of adrenaline. So the specific methodology for this study is observational study using a survey questionnaire. It's in two parts, the methodology. The first part is identifying the emergency departments throughout New Zealand, which will target the specific population of the severe asthmatics visiting emergency departments. So we'll be looking, part of that observational study, we'll be looking at the numbers of those population coming in. One advantage of the observational study for this and the survey will be identifying the admission records, which will identify the data that I require to see how many patients actually will be given IV salbutamol for their admissions to hospital. This is quite a reliable source, so already it has some validity, and the information gathered will be quite relevant to the study itself. Also, it already carries confidentiality and ethics already within the emergency department, so that will automatically cross into the study. For analysing the data, for the two parts to the study, the first party identifying the emergency departments will be a univariable observation or analysis, and the second part will be a multivariable analysis. So throughout, for the second part, we'll be identifying how many patients, their age, their sex, their ethnicity, the length of their admission stay, the use of IV salbutamol in the severe asthmatic that's admitted, any repeat admissions throughout the study time frame, and to gain these results and see these results fully, be the use of graphs and tables. Main implications for my practice. Well, the use of salbutamol is transferable across that medical profession from emergency departments into paramedic practice. Evidence will be clearly up-to-date procedures and best practice standards which will be used, and there will be clear evidence of that. I do need to acknowledge my bias in an interest for wanting to use IV salbutamol. As I stated earlier, perhaps replacing adrenaline as an option. In past studies, there's been clear evidence that there has been positive effects for the use of IV salbutamol, decreasing admission stays and repeat admissions. And I do currently know of 2 ambulance services that already use it, so that sort of piques my bias there. On the other hand, need to show some objectivity. There is a need for further research, as the current studies that I viewed in literature reviews clearly show some contradictions in effectiveness of IV salbutamol. Thank you.